Welcome to Forward Ever, Leading in Challenging Times, presented by Worth Wealth Management, a weekly conversation with area leaders about how to persevere during uncertain times. Now here's your host, Gary Shorman.
Hi everyone, welcome to Forward Ever, Leading in Challenging Times. Our guest today is Haz Med President and CEO Eddie Herman. We talk about challenging times. The program's all about this, and I don't know whether it's just this year following COVID, whether it's interest rates, all those things, but we know it's the challenging times, and it's especially so in the healthcare side of things. Eddie, welcome to our program. Thanks for taking time to join us today.
Yeah, Gary, thanks for having me on. I appreciate it.
This may be the best question of all. Is there ever a time when healthcare is not challenging?
I don't think so. I think that's just it's an ever-changing industry, right? So if it's not technologies, it's challenges of things like COVID or inflation. I think like a lot of businesses, everybody's got their challenges.
And at the same time, everybody wants a great hospital. And you guys had some, I'd say, wonderful news last month. Haz Med was recognized as as a 2024 top 100 rural community hospital. And everybody wants a great hospital when they're sick and they want to be there. And congratulations on that award.
No, I appreciate it. Yeah, I mean, it's actually, I got here in 2017, and we've actually been in that top 100 or higher 18, 19, 20, 22, and then now again in 2024. So our staff do a phenomenal job of taking care of patients, and it's nice to have that recognized on a national platform.
There's a lot of hubbub about Governor Kelly stopping by, and she was talking by, and really part of the discussion, or maybe the main reason for the discussion, was Medicaid expansion. Were you a little surprised that didn't go farther in the Kansas House and Senate than it did?
Yeah, I wish I could say yes. No, not really. It's become, unfortunately, a very bipartisan polar thing for the state of Kansas on Medicaid expansion. Once again, we're one of the last states that's left that hasn't expanded Medicaid. I think we're down to 10 this year. They're expecting that about another 2 or 3 will join. Not surprising, but always disappointing because we're really just leaving a large gap of about 150,000 Kansans who really don't qualify for Medicaid because they make a little too much money with their job, but then they don't make enough money that even with the stipend, they can't go out on the market and afford to purchase the Affordable Care Act insurance.
With that, everybody wants a great health care, a great hospital, but that does affect the ability, I think, to pay and some other things. How does that, not being a part of that expansion, affect Haz Med? Well, not counting all the other hospitals out there, right? How does that affect Haz Med?
Well, I think most importantly, while it does impact Haz Med, I hate to see how it impacts the patients who come in here that fall in that gap, because they're left with a pretty heavy burden of a bill if they don't have insurance, right? And then on the backside, we're not getting paid. And just for us alone, the people who would qualify for Medicaid, that's over $1.3 million every year of uncompensated care that we don't get paid for that we could.
One of the things that I know, and I don't think it fits into the Medicaid expansion kind of things, but we hear a lot about some turnover going on at the hospital with docs and otherwise. Can you fill us in on any of that?
Yeah, absolutely. I mean, we're not unlike any other industry, right? There's always turnover. And sure, when that turnover is a provider, it probably gets everybody's attention in the community a lot more than it does for other positions that we have that they're not probably as familiar with. We still have providers in all of our service lines. This hasn't impacted us on any single service line to where we're not able to provide that care. And I think that's probably the most important piece. Also, we have plans on how to cover all of our patients and still take care of Western Kansas. And sometimes that may be temporary help. It's already some positions we've already recruited for, and we know replacement is coming because we expected them to be retiring or leaving our facility at the end of their contract. So I would say we're also talking about a handful, 3 or 4 providers out of 74. So we're not talking about a large percentage of our medical staff that we have here.
When people think of Haz Med, many times they think of, who are the doctors that are there? But you show up and you're in the emergency room or you're somewhere to do that, you need a good doc. Having a good doc probably is preference over maybe a doc but how hard is it to recruit people to those key positions? Is that something that Haz Med is able to do?
Oh yeah, we've been very successful in recruitment. When you look at all of our service lines, I think here recently a good example would be we've just hired permanently 2 cardiothoracic surgeons. So we have 2 surgeons who can do heart surgery, thoracic surgery. One of them also can do vascular cases. So and those are really hard to recruit positions anywhere in the United States, much less in a rural area. I think it really depends, Gary, on what is that specialty. Neurology has always been difficult to recruit, but they can't even recruit enough neurologists to take care of all the patients in Kansas City or Wichita. So that makes it really hard for you to try and convince a neurologist to come to Hays, Kansas when they're needed even in metropolitan areas. But in other, specialties, family medicine, we actually have more family medicine docs now than we've ever had in our history at Hays Medical Center. We've got another one that'll be joining us next summer already that we recruited because we knew that Dr. Waring would be retiring, and so we wanted to make sure we had a replacement there. So, our staff they do a really good job. Hays does a really good job. It takes a community to recruit a provider because they're not just coming here to the hospital, right? I mean, they'll come here and work and be very happy. If they have a spouse, we're selling our community and our schools and everything else. So, that's where things like the school bond were really important. What Doug Williams and his team at Grow Hays with the new housing developments and the things that they have on the board and bringing retailers in, that all helps tremendously when we're trying to recruit.
Every time it seems like I'm up at the hospital, you guys are building or doing something different. What are the projects you're working on right now?
Yeah, right now the big project that we have is a hybrid OR. What this will allow us to do is right now we can do transaortic valve replacements. So rather than cutting your chest open, we actually go through an artery in your groin and we can go up and core out the valve and put a new valve in without ever having to cut your chest open. So tremendous technology allows us to do procedures on people who may be a little bit older and gives them even better quality of life for a longer period of time without the risk and complications that come from a true open chest surgery. And so this suite will have that technology to do all of those things. But if in emergency we need to convert to an OR, we don't even have to move yet. The cardiothoracic surgeon is right there at the bedside, as well as the OR team is ready. And if something were to happen, they can open the chest up and then correct any issues that you may be having if there's a complication. They're rare, but when they happen, you need immediate open heart surgery.
And I think, is that unusual for a hospital the size of Haz Med to have that type of, I say, swing type suite for surgery?
Oh yeah, actually, there's no one else that has a hybrid OR outside of the major metropolitan areas, but we're pretty unusual when it comes to the DeBakey Heart Center as it is. We're the only complete heart program. We have an electrophysiologist, interventionalist, cardiothoracic surgeons, cardiologists, advanced practice providers. We're covering all of Western Kansas for the majority of those needs around your heart.
Sometimes as a leader, whether it be in broadcast type of things or hospital, sometimes you feel like you kind of need a cardiac care unit right on site. Has that been one of the challenges as leading through in the challenging times that we've had over the last few years. COVID started it, but it hasn't really seemed to end because of some of the challenges created by staffing and other things. The challenges are big.
Yeah.
Where do you get your resources to say, here's the next thing we need to be doing to be sustainable?
Yeah, well, for us, we definitely keep an eye on the industry and where is that heading and what are the challenges for the industry. But we communicate with our providers. Our providers see where things are going, and we get input from them when we do our strategic planning. We have physicians that sit on our board, and so they're always there to also give guidance from the board perspective for the rest of our board members who may not be clinical. So we work as a team and look at national trends, as well as, many times we'll also reach out to vendors who do strategy and look at what's going on in the national landscape, and kind of rely on that. I mean, clearly, as you said, it's difficult, and I think Walmart just showed that, right? They just shut down the 57 plus clinics they have because it's a tough industry. There's not a large margin in healthcare, and for a company like Walmart, they've got shareholders, so they've got to have a return on their dollar. Our focus is different as a not-for-profit. Anything we make, we put back into our people and our technologies and taking care of patients in the region.
Well, there's some fun things going on that I want to talk about. I want to take a quick break and come back and talk about it. You have a new building, I'll say, on Haz Med campus. Takes care of children. Want to talk about that and talk about walking with a doc. We're going to take a break. Our guest today is Eddie Herman, who is President and CEO of Haz Med. Back after this.
The most successful investors are those that can keep their emotions in check and take a longer-term view at what portfolios will be worth 3 to 5 years down the road. I'd say that's the most important in determining what investor outcomes are. Market corrections will continue in the future. We've seen many of them over the years, only to see equity prices rise higher, and that'll be the case in the future.
Worth Wealth Management, enhancing lives and strengthening families.
Welcome back to Forward Ever with our guest, Eddie Herman, President and CEO of Haz Med. And Eddie, again, thanks for taking time, because you guys run 24/7, a lot of things going on over there, including some of the new things. You drive into the campus on the north side and you'll see a new children's area. How's that going? It's a beautiful little building, not little, a beautiful building there. How's that going with the daycare, childcare side of things?
Yeah, it's going really well. Clearly, as the CEO of healthcare, childcare was not in any type of training that I got. So we're glad to have a great partner in Bright Minds who actually runs the day-to-day on it. But it started out and we had about 50 in the very beginning of opening, and then I think within a month or two, we're actually completely full. So we've filled every slot out of the 72 that we had over there at the facility. And so we're already on a waiting list.
Well, it's a nice looking building. You have the Center for Health Improvement, and you see those things going. And Center for Health Improvement talks about being healthy. Walk with a doc. That was kind of fun. Are they still out walking, or are they back working?
Yeah. So, we've been doing Walk with the Doc since 2018. So it's hard to believe we've been doing it that long, but we always have great topics. Last month, we talked about donation of tissue and organ, and that was led by Dr. Aaron Hemphill, which was a great, it's a great segue to say we were recognized as a Center of Excellence in donation, and we're honored for that, for tissue and for organ. And then coming up on May 18th, if anybody's interested, we have another Walk with a Doc. It'll be with Tara Roa, and she's going to talk about diabetes and exercise, and that'll be at 8 o'clock at the mall. And that's her expertise. She is our diabetic kind of educator, advanced practice provider for us in our internal medicine clinic. Does a great job.
What a great opportunity to get to know a doctor in an environment that is, I'll say, more fun than walking in a hallway or being a patient to get all that done. So Last question, information technologies. There was a big hiccup. And how did Haz Med hang in through that whole hiccup of information technology and basically a cyber attack that went on? How are we doing there?
Yeah, we were really fortunate. Change Healthcare didn't have a ton of impact on us. A little bit of impact on the clinic side, which is causing us to spend quite a few more hours having to call things in versus use, the internet for either emails or electronic communication to get approvals on things. So now we're just having to go back to doing it, I guess what you could maybe refer to as the old way, and pick up a phone and have a phone call. But yeah, I mean, cybersecurity that's a hot topic, not only for us, but pretty much nationwide. And they've come out with some new guidance, and we're lucky. We've got a really talented team for us here. Scott Rolletter leads our IT, and then Alan Wamser is specifically our leader on cybersecurity just for our hospital.
There's not a day goes by that you talk about healthcare being side of it, but somebody doesn't try to cyber attack a hospital or a business. I think the headline today was one business, and it was the healthcare side of it. I think they paid a $22 million ransom fee to get their customers' names back. And it's like, wow, that's a crazy day if that happens.
Yes, it is. And for us, that's why in the industry you carry cybersecurity insurance, but more importantly, you just don't want it to ever happen and or limit it to what they can do. And that's where Alan's been instrumental. He's brought us up to top of class on all of our programming and our firewalls and everything that we do to protect our patients' information. We're up there with the best in class on that protection. We actually pay a company to do what you call a penetration test, where they actually test everything to see if they can find a way in, including trying to fool one of our associates into giving them information. But yeah, you're right. It's every day. It would probably amaze you when I see the numbers that come from our cybersecurity team on how many people attempt to get into the organization on just a monthly basis. It's pretty staggering.
It makes a CEO not want to sleep at night, right?
Yeah, I would agree. It does.
One of the things that I know the Schmidt Foundation is being a part of, and there's a Thank You Haz Med Day coming up on the 15th. And I have to say, people that work in healthcare, I'm married to one, and she's retired now. But when you're involved in healthcare, it's a full-time kind of deal. There's a thank you day for the folks at Haz Med, and looking forward to being out there and being a part of that.
Yeah, no, well, thanks to the foundation for actually pulling that together for us, the Schmidt Foundation. Yeah, it's a great day to just give them a chance to get outside. We usually have food trucks who come in, and they get vouchers so they can go and get a lunch of their liking, whether it's barbecue or anything else.
Is it hard to get a good thank you out to a company your size? Because I say a company, a hospital, what do you have, 1,100 employees? I mean, it's really hard to get the thank you side of that to those people, because they're in the trenches every day taking care of sick people. You're in the hospital because you're really sick, and being able to do that is hard, I think, from the CEO's chair to reach everybody and be able to do that.
It is. Let's see. Here we typically do rounding at least every quarter to give them updates and really to also just say, hey, thanks for the work that you do. We try to do little things off and on besides just hospital week and things like that to just say thank you. Whether that's having snow cones in the summer or something like that, to just give them a little break to get away, because it is great work, and it's also work that every one of our associates should be so proud of what they do for our communities that are in Western Kansas, because we really provide second to none care from a quality perspective. You're not going to find better care anywhere else you go. We're up there with the top in the nation, and we actually beat quite a few in the nation, and we beat most in the metropolitan areas around Kansas.
So if there's anybody has a question or a comment, is there a way to navigate through the Haz Med website if they have a question or comment to ask a CEO or ask some of the leadership if they have a question on something? I know rumors are always fun to talk about, but sometimes it's better to just ask a question. Where do they go?
Yeah, actually, we have a marketing team here, and so they can go through the marketing side of things. So if they call the main number and ask for somebody in marketing, then they can get in and get a question answered there. If it's more in a clinical nature and or about registration or bills or things like that, then clearly on the website we have numbers for our business office and or getting to somebody that's on the clinical side to talk with you on the phone for sure.
Well, Eddie, thanks for the work you and the team do, because we have friends, family that come from all over Kansas, northwestern Kansas to be specific, to come to the hospital here, and can't take for granted how important it is to have a great not just a good hospital, but a great hospital here. So thank you for you and the team and the board for putting together a great hospital team there, and appreciate you being on our show today.
Well, thank you for having me on, and I'm just lucky I get to be the face for an organization of associates that do such good work, and the providers we have are just second to none. So I'm blessed.
Well, we look forward to thanking them in a couple weeks here, and thank you for being on the show. Our guest today is Eddie Herman, who is the president and CEO of Haz Med. Thanks for listening. The program is brought to you by Worth Wealth Management, where you can live with confidence. I'm Gary Shorman.
Thanks for joining us for Forward Ever, Leading in Challenging Times, presented by Worth Wealth Management. Join us right here next week for another episode with host Gary Shorman. Until then, remember to move forward ever, backward never.